So today we will see the urinary systems. First we will see the objectives, what we will see in this video. So we will see the definition, function of urinary system, components of urinary system, gross structure of kidney, microscopic structure of kidney, process of urine formation, and renin, angiotensin aldosterone system. So all these are the objectives we will see in this video. So watch till the end. So we will see one by one. So in this video, the student should know about the function of urinary system, components of urinary system, and gross structure of kidney, microscopic structure of kidney, process of urine formation, renin, angiotensin, aldosterone system, we also called as RAAS in short form. So student should able to explain this all points. So the definition. First we know the definition. The urinary system is the main excretory system of the body which expel the waste and excess of material from the body. So the urinary system is also called as excretory system or a renal system. So urinary system is an excretory system. It will expel the waste material, excess of body waste, excess of body products which are not helpful for the body. It will expel through the urinary system. So it was the definition of urinary system. Next is the function of urinary systems. What all the functions our urinary system does? It maintain the homeostasis of water and electrolyte concentration. It can maintain electrolyte water and electrolyte balance, excretion of metabolic waste material from the body in the form of urine. So that metabolism through the what are the waste material that produced through the metabolism is called as metabolic waste. It is removed through the urine in the form of urine. Excretion of nitrogenous compound like urea and uric acid. It is these are the nitrogenous compound. They are expelled like urea and uric acid. Excretion of excess of ions and some drugs. In the acid and the base balance, production and secretion of erythropoietin, it produce and it will secrete the erythropoietin. Production and secretion of renin, and erythropoietin, and maintain the acid base balance. And excess of ions and some drugs and nitrogenous compound urea and uric acid are excreted metabolic waste and maintain the homeostasis and of water and electrolyte concentration. So the components of urinary system. So there are two kidneys which secrete the urine. So there are left kidney and the right kidney. In this you can see in the diagram there are two kidneys and there are two ureters which transport urine from kidney to urinary bladder. So there you can see the tube-like structure that is called as ureter. There are two. One is left side, one is right side that transport the urine from the kidney to the bladder. So the next is urinary bladder where the urine collects and temporarily stored. So in the bladder there are urine is collected in the urine bladder but it is stored temporarily. Urethra through the which the urine is discharged. Urethra is the part where the urine is discharged from our body. So it is called the urethra. You can see in the diagram there are two kidney and two ureter and one bladder and one urethra where the passage that urine is discharged. So first we'll see the kidneys. The location of the kidney. The kidneys lies on the posterior abdominal wall backside. There are two, one on each side of the vertebral column, behind the peritone, backside of the peritoneum, below the diaphragm. The kidneys are located. The right kidney is lower than the left, slightly. The right kidney is slightly lower than the left one. So kidneys are pin-shaped organ, about 11 centimeter. They are 11 centimeter long, 6 centimeter width, 3 centimeter thick, and they weigh about 150 grams in weight. So these are the what are the kidneys, how they look, where they located, about the kidney. These are the gross structure of kidney. So it is a gross structure of kidney. So this is a longitudinal section. When we cut the kidney into a longitudinal section, we'll see the three areas of the tissue. The first one is the fibrous capsule, the second one is the cortex, the third one is the medulla. The first one is fibrous capsule is surrounding the kidney. It will protect the kidney from the external trauma. Next is the cortex. It is a reddish brown layer of the tissue. It is immediately below the fibrous capsule and outside the pyramids. outside the pyramids, and just below the capsule is the cortex. It is a reddish brown in color. The medulla, the innermost layer consisting the pale conical shaped striation, they called as renal pyramids. So fibrous capsule, the outside what you see there, it is a fibrous capsule. So the cortex is here, and the medulla is what the triangular shape what you see, they are the renal pyramids, they are called as medulla. So this is what the anatomy of the kidney. This is a microscopic structure of kidney. When we see the microscopically what is inside the kidney, there are nephrons. They are also called as functional unit of the kidney. The kidney is composed of about 1 million of functional units, means the nephrons are present. So in the kidney there are 1 million nephrons are present. There are smaller number of collecting ducts are present that will transport the urine through a pyramids of renal pelvis. So they will transport through the pyramids of renal pelvis. The tubules are surrounded by small amount of connective tissue. Small tubules are present. They are surrounded with the connective tissue. They contain the blood vessels, nerve, and the lymph vessels are contain. So kidney composed of 1 million of functional unit, they are called as nephron. They are smaller number of collecting duct that transport the urine through a pyramid to the renal pelvis. So this is what the microscopic structure of the kidney. Next is the nephron. The nephron consists of tubules closed at one end, it is closed, and other end is open in a collecting tubule. The closed end is intended to form a cup-shaped glomerular capsule is known as Bowman's capsule. At the one end where that is closed, there is a cup-shaped glomerular capsules are present. We will call as Bowman's capsule. The Bowman capsule, that remainder of the nephron, is about 3 cm long and described in 3 parts. So from Bowman's capsule, the remainder of the nephron is about 3 cm long. It is divided into 3 parts. First one is proximal convoluted tubule, PCT. The medullary loop is also called as loop of Henle. The next is the distal convoluted tubule, is also called as DCT. There are 3 parts. So this is the diagram of the nephron. You can see the nephron, you can see the kidney, you can see the tubules, tiny tubules, you can see the Bowman capsule. Next is the process of urine formation. How is the urine is formed? The main function of the kidney is to formation of urine, and it is divided into 3 parts. 3 process. First one is filtration, second one is selective reabsorption, third one is secretion. Filtration, selective reabsorption, secretion, third one is. So this is a process how the urine is formed. The process of urine formation. First one is filtration, is also called as glomerular filtration. Beginning of the process is the first process is the beginning of the process, a process by which the blood courses through the glomeruli. Much of its fluid contain both useful chemicals and dissolved waste material soak out of the blood through membranes where it filtered and then flow into the Bowman's capsules. So there are some, it is a process where the blood through the glomeruli, so much it take out fluid, it take the useful chemicals, dissolved waste material, soak out the blood through membrane where it filter, and it flows next to the Bowman capsules. After all filtration, it flows to the Bowman's capsule. The blood will flow, what it contain much fluids, chemicals, dissolved waste materials. Membrane, what is the membrane? It will soak, it will take, and next it will flow to the Bowman's capsule. Filtration is assisted by difference between the blood pressure in the glomerulus and the pressure of the filtrate in the glomerular capsule. So filtration is difference between the blood pressure, by the difference between the blood pressure and in the glomerulus and the pressure in the filtrate in the glomerular capsule. The volume of filtrate formed by both kidney each minute is called as glomerular filtration rate. So the volume where the filtration formed by the kidney in just 1 minute is called as glomerular filtration rate. It's also called as GFR. In healthy adult, the GFR is 125 milliliter per minute. So in healthy adult, the GFR is 125 milliliter per minute, or that is 180 liter per day. that is equals to 180 liter per day by both the kidney in 1 day. By both the kidney 180 liter per day by both the kidney in 1 day. So it is also called as glomerular filtration rate in 1 minute. Next, second process is selective reabsorption. The movement of substance out of the renal tubule back into the blood capillaries located around the tubules. So it is a movement where the substance outreach renal tubules. When their substance are out of the renal tubules, when they come in back to the blood capillaries, the blood capillaries located around the tubules, so it's also called as peritubular capillaries. They are also called as peritubular capillaries. Some constituent of glomerular filtrate do not normally appear in the urine because they are completely reabsorbed unless blood levels are excessive. So some constituent are there. They are glomerular filtrate like glucose, amino acids. They do not normally appear in the urine. They do not come usually in the urine because they are completely reabsorbed unless they are completely reabsorbed. They are absorbed, completely absorbed. There is no any amount 1% amount of glucose or amino acids. They are completely reabsorbed unless the blood level are excessive. If the blood level is excessive, then it comes to the urine, that is glucose and amino acid. So this is what the selective reabsorption. So it is a selective reabsorption. How the selective reabsorption occur? Here Bowman capsules and there is a glomerulus. You can see here the Bowman's capsule and the glomerulus. The urine in the Bowman's capsule, it will move when it is going through the tubules. The what are the constituent are essential, they are absorbed through the membrane. So all are absorbed, that is almost all glucose, amino acids, most minerals are absorbed. Most of the water is absorbed by the osmosis. So in the next it will come to the loop of Henle. Some water content is remained. Then it will go to the distilled convoluted tubule. In distal convoluted, some more mineral salts are absorbed, some more mineral salts. Then we'll go to the distal convoluted tubules. Then it will go to the collecting duct. In some water is collected there. Next, here when it is at the end of the collecting duct, it is a metabolic waste, that is urea, keratin, uric acid, and excess of water and mineral salts are present in the urine. This is what the selective reabsorption in the nephron. Next is tubular secretion, disposing of a substance not already in the filtrate, that is drugs, eliminating undesirable substance that have been reabsorbed by passive process, that is urea and uric acid, ridding the body of excess potassium ion by secretion of hydrogen ion for controlling the blood pH. So we are here disposing of substance that is not already filtrate, which is drugs. They are not filtrate, so they are disposing. So eliminating that is undesired, that are that have been reabsorbed by passive process, that is urea and uric acid. So ridding the body of it is a ridding the body of excess of potassium ions. So which is are more potassium ion, they are excess of, they are ridding the body, they are removing from the body by secretion of hydrogen ion for controlling the blood pH. To control the blood pH, there is a secretion of hydrogen ion. So the next is composition of urine. In the urine, what are the composition? There is water is 96% of water is present, urea is present in 2%, uric acid, keratinine, ammonia, sodium, potassium, chlorides, phosphates, sulfates, oxalates. So all these are present in 2% in a urine. Composition of urine, water is present. Water is in higher concentration, that is in 96% of water content is present. All these are 2% and other these are the 2% are present. So this is what the composition of urine. So the next is renin angiotensin aldosterone system, also called as RAAS in short form. So the RAAS is a hormonal system. This is what the hormonal system. This RAAS regulates the blood pressure and fluid balance in the body. This system is involved in kidney, liver and lungs. In these three systems, the renin angiotensin aldosterone system is present. It is a hormonal system. There are some important factors which involved in RAAS. So first one is renin, next one is angiotensinogen, angiotensin 1, angiotensin 2 and aldosterone. So these are some important factors that are involved in RAAS. Next, first one is renin. It is released from the kidney. So the renin is released from the kidney, hydrolyzes angiotensinogen. It hydrolyzes the angiotensinogen. Convert the plasma protein angiotensinogen into angiotensin. So renin will convert the angiotensinogen into angiotensin. So hydrolyzes angiotensinogen. So this is what the about the renin. So the next is factor affecting the renin release. Which are the factors that affect the renin release? So increased by and decreased by. Increased by decreased arterial BP. When arterial BP is decreased, it will increases. When decreased BP in glomerular vessel, it will increase. Renin release is increased. Increased loss of sodium and water. When it is loss of sodium and water is increased, the increase in the renin release increases. Increased sympathetic activity. When it is sympathetic activity is increased, increase in the renin release. So decreased by, when renin release is decreased, when the sodium water is retained, when the in the body sodium water is retained, decrease in the renin release. When BP is increased, renin release is decreased. Activation of 81 receptors. When the 81 receptors are activated, there is a decrease in the renin release. So how it is increased by and how it is decreased by, it is a difference when it is increased and when it is decreased. Next is angiotensinogen, produced and released by the liver. This is produced and released by the liver, that is angiotensinogen. Level increased by corticosteroids. When we take the corticosteroids, then the levels of angiotensinogen increased. In estrogen and thyroid hormone, these are level when the level is increased when the corticosteroids, estrogen and thyroid hormone is released. So the next is angiotensin 1. It is produced in the kidney through action of renin on angiotensinogen. When renin is acted on angiotensinogen, the kidney will produce angiotensin 1. So when the renin is acted on angiotensinogen, the kidney will produce angiotensin 1. Has no biological activity. It has no biological activity. It precursor to angiotensin. It is precursors of angiotensin. So this is what the angiotensin 1. So the next is angiotensin 2. It is produced by ACE in lungs. ACE is nothing but angiotensin converting enzyme. ACE is nothing but angiotensin converting enzyme in lungs. It is produced by angiotensin 2. Main hormone responsible for increase in blood pressure. Which is a hormone responsible for the blood pressure? That is angiotensin 2. Stimulate Na, sodium reabsorption, and H plus secretion in proximal tubules of kidney. So it stimulates the sodium secretion reabsorption and H plus secretion in proximal tubules of kidney. So it is what angiotensin is responsible for, the hormone that is responsible for the increase in the blood pressure. This is what the angiotensin 2. Next is angiotensin 3. Has 40% of activity of angiotensin 2. It has a 40% of activity of angiotensin 2. Has aldosterone. So it has aldosterone producing activity. So it produces aldosterone, cause increase in the mean arterial blood pressure. So in arterial, we have arteries, there is a blood pressure is increased by this angiotensin 3, cause increase in the mean arterial blood pressure by angiotensin 3. So this is about the angiotensin 3. So the next is angiotensin converting enzyme. I have told about ACE. So it is angiotensin converting enzyme. Act in the lungs, catalyzes conversion of angiotensin 1 to angiotensin 2. It catalyzes when the angiotensin 1 is converted into angiotensin 2. It acts as a catalysis. Degrades bradykinin to convert vasoactive peptides. So it degrades bradykinin to other vasoactive peptides. So it degrades. So this is about the angiotensin converting enzyme.